Welcome yet to another episode of the Weekly Five. My name is Wale Shege Monyere, and as usual, let us get down to business. For this session, we shall be discussing the shoulder region, the shoulder joint, the arm, and the cubital fossa. 5 questions, each has 3 parts. First question. Now, this question is testing your knowledge of the proximal arm regarding uh, the neurovascular structures and also the muscular structures which are found in the proximal part of the arm just after the axilla. Now we have been asked to name A and B. This muscle here, it has 2 heads, and that's the biceps brachii to differentiate it from your biceps femoris. A is the short head, which originates from the coracoid process together with this muscle here, known as coracobrachialis muscle. B, on the other hand, is the long head of biceps brachii, and it originates from the glenoid tubercle. So that's A and B. Now, C here, you need to identify what structure is this for you to know what C is. And this structure, labeled D now, that's the brachial artery, which is a continuation of the axillary artery. So at this point, this is the axillary artery. But after crossing the teres major, which is this mass over here, after crossing teres major, actually this is latissimus dorsi, not teres major. Teres major is this muscle here. After crossing it, it now changes its name to the brachial artery, okay? The brachial artery. So this branch here, you can see it's a branch from the brachial artery, and it is following this nerve. This nerve here is the radial nerve. So this artery over here, which follows radial nerve, that's your deep brachial artery, also known as the profunda brachii artery, and the terminal branches of that artery are 2, the middle and the radial collateral arteries. And so the radial collateral artery and the middle collateral artery, those are the terminal branches of the deep brachial artery. Now, D, we have named it as the brachial artery, and the terminal branches of the brachial artery within the cubital fossa, just at the apex of the cubital fossa, is the radial artery and the ulnar artery. And that's it for the first question. So you've been able to identify all these structures. That's the coracobrachialis. This is the radial nerve, the deep brachial artery, the brachial artery, the short head of biceps brachii, and the long head of biceps brachii. On to the second question. Now this is testing your knowledge of the posterior compartment of the arm together with some part of the shoulder. So A over here, we've been asked to identify structures B and D. So this is B and this is D. So this is triceps brachii. Triceps, as the name suggests, has 3 heads. The B over here is the long head. D over here is the medial head. And this unlabeled one, this is the lateral head. State the innervation of A. A is the teres major muscle. This is the teres major muscle, and the teres major muscle is innervated by the lower subscapular nerve. C over here, this is the posterior. These are the posterior fibers of deltoid, and the chief action of those fibers is it enables with shoulder extension. Okay, extension of the shoulder joint, the glenohumeral joint to be specific. Okay, so yeah, we are done with this question. This here is the olecranon process, where the triceps brachii is attached, and this is the tendon of the common tendon of the 3 heads of the triceps brachii. On to the third question, which is now testing your knowledge of the cubital fossa now. we have been asked to identify structures labeled 3 and 4. So this is 3, this is 4. So to know where is medial is lateral, you just need to know the arrangement of the structures within the cubital fossa. The most medial is structure labeled number 1, and this is your median nerve. Structure label number 2 is the brachial artery, and you can see it is divided into the radial artery, that's the radial artery, and the one which is moving deep, that's the ulnar artery. Structure label number 5 is your biceps brachii tendon, and structure label number 6, this is the main trunk. This is the main trunk of a radial nerve, but this nerve, you can see it is giving rise to this superficial branch, and this deep branch, which you can see is disappearing under this muscle, which is supinator, because it passes between, or rather, the deep branch passes within the substance of the supinator, and then it emerges on the posterior compartment of the forearm as the posterior interosseous nerve. Now, 3, so we have identified this is the medial. So the medial boundary is pronator teres. So this is pronator teres muscle. And the 4 is the lateral boundary, and this is brachial radialis muscle. Now we've been asked to identify the distal attachment of 5. So the biceps brachii tendon attaches to the radial tuberosity. Please be able to identify the radial tuberosity on a radius. Name 2 possible entrapment points of 1. So what are some possible entrapment points of the median nerve? There are so many, but I'll just restrict myself to just mention 2. One, which is the most common site, is the carpal tunnel. Okay, the carpal tunnel at the level of the wrist, and the other one is just within the cubital fossa as it passes between the 2 heads of pronator teres. So this pronator teres has 2 heads, a humeral head and an ulnar head. So as it passes between the 2 heads, that's a possible entrapment point of median nerve. So median nerve. So those are the entrapment points of median nerve. So carpal tunnel and between the 2 heads of pronator teres. Now we have other entrapment points, such as the ligament of Strathers. I say ligament of Strathers, which is not the same as the arcade of Strathers, which is usually in some individuals, they have a fibro-osseous bridge at the distal part of the humerus. So you find a bridge, rather some fibrous band of tissue extending from the medial epicondyle towards the medial supracondylar ridge, so connecting maybe this part towards this part. So it can also cause entrapment of the median nerve. So please go read about entrapment points of these other nerves, such as the radial nerve and also the ulnar nerve. Um, name the joint shown in red. So which joint is this, and state its type and variety. So this is the acromioclavicular joint, and it's a synovial joint, and it's of planar variety. Now, the structure pointed here is the greater tubercle, and attached to the greater tubercle, we have 3 muscles: to the superior facet, supraspinatus; to the middle facet, infraspinatus; and to the inferior facet, teres, minor muscle. Now, name 2 muscles that cause abduction. AB, abduction of the joint shown in green. So the joint here is the glenohumeral joint. So the muscles which cause abduction there, we have supraspinatus, which initiates. So okay, let me just write this. From 0 to around 15 degrees, we usually have supraspinatus, and then 15 degrees to 90 degrees, we have the middle fibers of deltoid. Okay, middle fibers of deltoid, and then above 90 degrees, that is now to raise your hand as if you are answering a question in a class. That's trapezius, the upper fibers of trapezius, the upper fibers of trapezius. So those are the 3 muscles that cause shoulder abduction. Okay, so for the first 15 degrees is supraspinatus, then deltoid takes it. So at 90 degrees is as if you are holding your hand out in a straight manner. And then once you start to raise it over 90 degrees, now the upper fibers of trapezius are engaged. All right. On to the last question, which is now testing your knowledge of the scapular region, the shoulder region. We've been asked to identify structures C and E. So C is this. So yeah, C is this structure and E is that structure. So you can see here we have this quadrangular space. That's the quadrangular space over there. And remember the quadrangular space. Structures that traverse the quadrangular space. C is one of them. Let me erase that so that you can see the two structures. So C is one of them. And then we have this structure over here, which is not labeled, this one. Allow me to call it X. So C is the axillary nerve, and you can see axillary nerve on its root. You can see it is piercing the substance of deltoid. This is deltoid because it's the one which supplies deltoid, okay? So C is the axillary nerve, and then E over here is the long head of triceps brachii, okay? X over here is the posterior humeral circumflex nerve, the posterior humeral circumflex. So the not nerve artery, okay? From the third part of axillary artery, okay? The posterior humeral circumflex artery from the third part of axillary artery. Now, we've been asked to state the lateral attachment of A. So A over here is the teres major. Please remember teres major is not a rotator cuff muscle. It's attached laterally to the medial lip of the bicipital groove. So the bicipital groove, remember the bicipital groove. So the bicipital groove, it's a groove uh, on the shaft of humerus. So it is literally a groove, as the name is suggesting. So I'll try to draw a groove, and then it has two lips. So a lateral lip, so that's lateral. This is medial. So attached to the lateral lip of the bicipital groove, we have pectoralis major muscle. Attached to the floor of the bicipital groove is latissimus dorsi, and attached to the medial lip is teres major muscle. Okay, so please remember that arrangement. And then we've been asked to state the innervation of B and D. So B over here is your teres minor muscle, innervated by the axillary nerve also. And D is infraspinatus, which is innervated by the suprascapular nerve. Remember, suprascapular nerve comes from your superior trunk of the brachial plexus. Okay, so this structure which I'm not naming here, if you've named that as latissimus dorsi, you are correct. Now, I think I'm done with the 5 questions. Once again, thank you for your attention, and stay tuned for next week's weekly 5. And check out the upper limb playlist on this channel for more detailed anatomy videos. That's it for today. See you next week. Bye bye.